After wins last month in New Jersey and Virginia, as well as a closer than expected special election in Tennessee, Democrats are hoping the wind is at their back ahead of the 2026 midterms, and that even some reliably red seats in the House, and the Senate could possibly be flipped. And joining me now is Dr. Annie Andrews, a pediatrician and Democratic candidate for Senate in South Carolina. Doctor, thank you so much for joining us here on Meet the Press Now.
Thank you so much for having me.
Now, as you know, South Carolina has not had a Democratic senator in more than 2 decades. You yourself ran for Congress just a few years ago. You lost by double digits. So why do you think you can flip the Senate seat now?
2026 is really an unprecedented moment in politics here in America. Whether you're a Republican, a Democrat, or an independent, you're starting to understand that Washington, D.C. is broken, and far too many of our elected officials, including my opponent, Lindsey Graham, don't seem to be too interested in solving those problems. That's why I got off the sidelines in the first place when I decided to run for Congress back in 2022. And it's why I'm in this race now, because South Carolina deserves a senator who's willing to fight the fight here in Washington, D.C. to deliver results back at home.
But as you know, Senator Graham has had quite the grip on South Carolina for a very long time. Specifically, why do you think you can unseat him? I understand it's a very different moment in politics, but he still has a lot of support in South Carolina.
He does, but he also has a very low approval rating. About a third of South Carolinians, 34%, approve of Lindsey Graham's current status as a senator. He's been in Washington, D.C. as South Carolina senator for 22 years. If I ever got 34% on a class in medical school, I wouldn't be a doctor. Lindsey Graham is objectively failing at his job, yet he thinks he should be able to continue to do that job. But I have other ideas in mind. And unlike Lindsey Graham, I am not a career politician, nor do I ever seek to be. I am a pediatrician. I'm a public servant who saw for 15 years in children's hospitals the problems that South Carolina's kids and families were facing. And I see politics as a path to solve those problems at the systemic level. And that's exactly what I'm going to do when I get elected.
The president, though, has endorsed Lindsey Graham. And I know, there have been some on the right, to Lindsey Graham's right, who aren't very happy with him. But still, the president has endorsed him. And even though some of his critics, including yourself, I'm sure, accuse him of being a flip-flopper on issues, he does enjoy the president's support. How do you overcome that?
We're building a grassroots movement in South Carolina. I have over 1,000 volunteers in our volunteer database. Our average donation is under $30, and people are ready for a change. They're seeing that Lindsey Graham has really changed from who he first was when he was elected 22 years ago to who he is now. And he really doesn't stand for anything other than what will keep Donald Trump happy and what will help him get reelected. And a lot of people in South Carolina are ready for a new voice.
I want to talk an issue very close to your heart, which you mentioned, you being a pediatrician. Of course, healthcare costs are a big issue and likely will be in the midterms. Congress is trying to come up with some sort of solution for rising healthcare premiums. You have previously called whatever Republicans are considering a scam. What is your solution to addressing rising healthcare premiums?
We need to get serious about solutions. Lindsey Graham has had 22 years to come up with an alternative to what he sees as a failed American healthcare system. Our healthcare system has been broken long before Donald Trump got his hands on it. And that's because it is really profit motivated. It is not patient centered. So I support any policy that would put patients at the center of our healthcare system. And right now, private insurance companies are motivated by increasing their profits. And so much of the money that we as patients, we as insurance company plan holders pay into the system goes to their profits, not to the provision of health care. So I support policies that increase access to affordable quality health care for South Carolinians, including something like a public option or Medicare for those who want it.
Quickly, is the plan put forward by Senate Democrats to extend health care subsidies by 3 years, is that enough?
That's not enough at all, but it's absolutely what we need to do in this urgent moment, because if we allow the ACA tax subsidies to expire, hundreds of thousands of South Carolinians are going to be priced out of the insurance market and will overnight on January 1st no longer have a health insurance plan.
Now, as Democrats try to sort out their approach ahead of these midterms, I want to get a sense for how you see the issue of affordability. Are you aligning yourself more with the Mayor-elect Mamdani approach in New York, or do you consider yourself more moderate when it comes to that?
I align myself with anyone who's willing to get results. So many South Carolinians, including those families I cared for 15 years in the Children's Hospital, truly can't pay to get out of the parking garage when their child is discharged from the hospital, let alone afford their prescription drugs, be able to put food on the table, afford childcare. A lot of these families are working multiple low-wage jobs just to make ends meet. And as a result, they have to leave their child in their hospital room alone overnight so they can go to their third shift job. So I'm willing to work with anyone on any solution that will lower the cost of living for folks in South Carolina.
And I want to get your thoughts on current Democratic leadership. Do you believe that Senator Schumer should remain as the leader of the Senate Democratic Caucus?
So I've never met Senator Schumer, and when elected and when I'm sworn into office in January 2027, I'll hear anyone out, anyone who's willing to work to solve the problems of South Carolinians.
But at this point, as you're running for the Senate seat, do you agree with current Democratic leadership as it stands now, or would you like to see a change?
I believe the entire party needs to see a generational shift in change and generational change. And I believe that I can be part of that as a non-career politician, as a pediatrician, as a mom of 3 young school-age children. I'm in the thick of parenting. I understand the challenges that parents like me are facing. And I want to get to Washington, D.C. to solve those problems. And we need more leaders with lived experience, with other professional backgrounds like mine, to get up to Washington, D.C., to roll up our sleeves and actually solve problems and stop playing politics with people's lives.
Dr. Annie Andrews, candidate for Senate in South Carolina. We really appreciate your time.
Thank you so much.
We thank you for watching. And remember, stay updated on breaking news and top stories on the NBC News app or watch live on our YouTube channel.